Hello and welcome to ethics training for first responders. This overview of ethics training for first responders in emergency medical services will cover organizational ethics and how they are rooted in one's code of ethics and relate that to first responders and the importance of ethics for first responders in order to conduct public safety and in turn provide the best possible outcome for patients. We also talk about ethical theory in EMS and apply traditional ethics theory to what emergency medical services is about and what first responders have to abide by to work ethically and provide for public safety. We'll talk also about the code of ethics and within first responders agencies, and we will also talk about an ethical scenario that you may come across as a first responder. By applying ethical theory to EMS and to first responders, we can kind of bridge that gap between theory and practice. Two of the theories that come to mind with first responders and EMS would be Aristotle's virtue theory, that public servants in EMS embody virtuous behavior, striving for success, ongoing learning, and through experiences in EMS scenarios and first responding to incidents, become more knowledgeable and more comfortable in somewhat of a very uncomfortable environment. It is the public's interest for EMS personnel to put themselves at risk and put themselves in front of others to protect lives, environment, and property of the public. And even if it is in the case of possible injury or harm, first responders embody this virtuous behavior that kind of bridges that theory of Aristotle's virtue theory. Also, John Stuart Mill theorized utilitarianism by providing that the outcome justifies the means, and the outcome of first responders and the efforts of first responders are for the outcome of success, for life preservation, for patient care. And from the code of ethics and from the outcomes of sustaining life derive policies and procedures that are based on maximizing the benefit of the most amount of people or the most amount of patients, depending upon whatever ailment they're having or traumatic injury that they have. There's policies and procedures that provide that framework of patient care that provides the best possible pathway to success for each patient suffering from whatever ailment or injury at that time. First responder code of ethics are important to first responders as they provide the foundation of moral obligation for EMS providers. From this foundation, policies and procedures are established to determine the best practices for patient care. It is necessary for all first responders and EMS personnel to understand the code of ethics to allow for that foundation of understanding of one's role and responsibility as a first responder. And by knowing these, one is set up for success by abiding by these code of ethics and providing patient care and providing public service. In this ethical scenario, you will be required to understand your duty to act as a first responder by the underlying framework of the code of ethics and what you are supposed to do. In this scenario, you arrive first on scene with your partner to a single vehicle accident on the side of the highway. Upon arrival, you notice significant passenger space intrusion on the vehicle and significant body damage. As you approach the vehicle, you notice one patient in the driver's seat of the car unable to extricate themselves. Upon extricating the patient, you noticed several medication containers in the driver's side and on the floor of the vehicle. When you do your patient assessment, you ask the patient their history of medical problems, allergies to medications, and medications they're currently taking. When the patient responds with negative history, allergies, and medications, you start to wonder what type of medications that were in the vehicle with the patient. You have your partner grab the containers and you look at what type of pills that are in those containers. You notice that the containers are unmarked, and you have to at this point, you're starting to think that this person is intoxicated or under some type of influence of the medication that is found in the vehicle. Prior to law enforcement's arrival, you continue your patient assessment and indicate that patient does need transport to a local hospital. In your documentation, you note that the patient has no history of medical problems, allergies, and medication, and does not currently take any medication because that is what the patient told you. As law enforcement pulls up on scene and questions you as an EMS provider and witnesses nearby, they are getting the entire story of what happened to the person and the vehicle and any type of damage that was sustained on the freeway or on the side of the road. At this point, you could do one of two things. One, you could transport that patient, indicate at the hospital that the patient has no history, allergies, meds, or do you indicate to law enforcement and in your documentation that additional medication was found in the vehicle at the time of arrival, a medication that was unmarked and possibly consumed by the individual due to some abnormal vitals, including pupils that were blown and possible indication of drug use. In this scenario, the virtuous or the ethical conduct that would be required would be for proper reporting procedures of additional medication, unknown medication found in the patient's vehicle, as well as notifying the law enforcement agency to create to allow for justice and fairness in the case that this person was in fact intoxicated or under the influence when he suffered this accident by himself on the side off the freeway. And regardless of the possibility of a patient being under the influence of alcohol, drugs, or in this scenario, crashing the vehicle, patient care remains the same, and all patients are treated with the utmost respect and dignity, as well as providing that best outcome for that patient, including transporting the medication to the hospital to indicate possible intoxication or even overdose that would require specific medication in the case if it was an opiate-induced overdose to save this person's life and at least get them treatment and back and recovering. And that concludes our ethics training for first responders. I hope you enjoyed it and have a little bit of a foundation and understanding of ethics in the industry of first responders and emergency medical services.